As warm summer temperatures settle in, the risk of anaphylaxis from bee stings and insect bites increases. But these aren't the only causes. It's important to know that allergic reactions and anaphylaxis, while related, are not the same. In this video, we'll explore the science behind anaphylaxis and how it presents. Anaphylaxis often starts when an antigen is introduced to the body, like through an injection or ingestion. The first exposure might show no reaction, but the body creates IgE antibodies that attach to mast cells and basophils. This is the sensitization stage. The body is now primed for a potential reaction. The second time the antigen enters, these mast cells and basophils degranulate. They release massive amounts of histamine and other chemicals. Fun fact, even some drugs like morphine can trigger histamine release. This response can be localized, an allergic reaction, or system-wide anaphylaxis. Drug-induced anaphylaxis is common because injected drugs rapidly circulate. The same thing happens with bee stings. The body floods with histamine. Anaphylaxis primarily affects the GI system, skin, respiratory system, and cardiovascular system. The primary cause of death is a combination of respiratory failure and distributive shock. Distributive shock results from decreased vascular tone caused by histamine. Histamine causes blood vessels to dilate and become permeable. This vasodilation is likely caused by nitric oxide released by histamine, similar to how nitroglycerin works. Imagine poking tiny holes in a fire hose. Plasma leaks out, blood pressure drops, leading to circulatory collapse. This fluid loss reduces preload, decreasing stroke volume and cardiac output. Plasma leakage also causes angioedema. Good news, histamine's effect is short-lived due to enzymes in the plasma. Leukotrienes cause bronchioles to narrow, leading to wheezing. They also increase vascular permeability. While the body produces leukotrienes normally, overproduction can cause problems like asthma or anaphylaxis. The effect of leukotrienes lasts longer than histamine. Symptoms often appear within 60 seconds of exposure, but sometimes it can be delayed up to an hour. The faster the onset, the more severe the reaction. Rapid assessment is critical. Patients often feel a sense of impending doom due to low blood pressure and oxygen to the brain. Watch for airway problems, laryngeal edema, a scratchy throat, hoarse voice, stridor, and respiratory collapse. As things worsen, patients may become restless, combative, and eventually unresponsive. Breath sounds might be diminished or absent. Early skin changes are key. A fine red rash, especially around the injection site. Hives, urticaria. Large red raised bumps appear and disappear suddenly. Angioedema is caused by plasma leaking from blood vessels. Increased GI motility can cause hyperactive bowel sounds, nausea, vomiting and diarrhea, worsening hypovolemic shock. Understanding anaphylaxis is vital for healthcare providers. Doctors and nurses must be able to distinguish between allergic reactions and anaphylaxis, comprehend the underlying mechanisms such as IgE-mediated mast cell degranulation, and the subsequent release of histamine and leukotrienes. Rapid assessment and intervention are paramount, as the progression can occur swiftly. Prompt diagnosis and treatment not only saves lives, but also enhances the quality of care provided in emergency settings.